Today I'm speaking with Ryan Hummel, who is the Director of Ambulatory Services, as well as Dr. Chris Notte, who is the Medical Director at Abington Health Urgent Care Center that recently opened up. So today we're just going to talk about the venue and learn a bit more about what urgent care centers are and find out what the progression has been since the opening. Ryan, can you give us a little background of what your role is with the urgent care center?
So I partner with Dr. Notte in finding locations and executing ambulatory services for the community that Abington Health serves. So we just launched this location in Flourtown on 1820 Bethlehem Pike in late May.
Okay, and so how has it been going? How's the turnout, the community response?
It's been great. We've seen lots of folks from the community come in, kind of walking in to see what we do and how we treat patients effectively. So it's been very successful.
What makes Abington Health Urgent Care Center different from those who are not affiliated with the hospital?
Well, that's a great question. So we treat lots of different illnesses and ailments, breaks, strains, and sprains, to flu-like symptoms. But what sets us apart, and Dr. Notte can elaborate even more, is we have a connectivity and a continuity of care with the patients. If a patient comes in and is seen, we can also connect that patient with a follow-up appointment, whether it be an orthopedic surgeon, a podiatrist, a dermatologist. And what sets us apart is we will call back every patient. So 100% of our patients are called back within 48 to 72 hours to check up on how they're doing, how they're feeling, and that we delivered the quality care quickly delivered.
And that's good because you're getting feedback on services that work as well as where there may be improvement.
That's correct. For the most part, we've gotten glowing responses from patients, but we also treat feedback as a gift. So we want to make sure that every patient is treated as wonderfully as possible.
Okay. And Chris, talk to us about what your role is as the medical director.
Well, I wear a couple of hats, so one of which is I serve here as one of the physicians treating patients at the Urgent Care Center, and that's probably the best part of my job, to be frank with you. I love connecting with patients. I'm formally trained as a family doctor, and I never really want to lose the connection with the patients and the opportunity to treat people at all stages of life. But also as medical director, it's my job to really oversee that not only are we providing good quality care here in the centers, but that we're thinking more broadly about how to make sure that our clinical strategy is really meeting the needs of the community. I want to make sure that the physicians here are using the latest standards and guidelines, treating people not only with great quality but also with great respect, and making sure that the other physicians in the community are aware of our services and confident in our services, and that continuity of care that Ryan mentioned is maintained. There's a lot of diplomacy involved. Anytime you start a venture like this, you want to make sure that the community is aware of what you're doing. You want to make sure that they're confident that you're going to deliver the quality care that you claim you're going to deliver. And I really think that that's where my role fits in, that from a medical perspective, we're delivering on our promise.
And what are some of the services that you offer here?
Well, we like to say that we fit right squarely between the primary care physician's office and the emergency room. We treat everything from colds and flus, dehydration, lumps, bumps, sprains, lacerations. We can do x-ray right here on site. We have low-dose radiation in our x-ray machine, which is great, especially when you're dealing with the younger population. The other things that we can do include laboratory services. We can draw labs right here on site, and in many cases, many of those labs can be reported back within 5 to 10 minutes. So we get instant information right at the point of care where we need it. So we really will we'll take all comers. Now, we don't want to stand in the way of people going to the emergency room when there's a true emergency. If there's advanced imaging needed or a truly serious medical condition that needs to be addressed, we certainly don't want folks coming here. We want them to go to the emergency room where they belong. And likewise, we we don't want to do primary care. I think that's another thing that really sets us apart from other urgent care centers. We don't want to treat your hypertension on an ongoing basis or your diabetes. We know that the best place for that to get treated is in the office of a primary care professional that knows you the best and is going to follow you for the long term. We want to see people episodically when they need us in a pinch, when they can't get in to see their doctor, which is what we're hearing from lots of patients, because they just can't get an appointment. I think that's where we fit, and that's where we want to be.
So what are some of the more prevalent illnesses that you have seen since you've been open?
Well, we've seen a lot of things, certainly a number of things, and I'll let Ryan comment on that because he's the guy that really kind of monitors the statistics, but I can say briefly that we've seen certainly lots of sprains and orthopedic cases and some upper respiratory stuff, certainly in large quantity as well. Ryan, do you want to comment on that?
Sure. I think that since we've been opened in the spring in both locations, we have a location in Feasterville as well. A lot of illnesses and ailments are seasonal in nature. We actually have seen an influx of poison ivy, some summer rashes, and now that school's out, a lot of the kids are playing outside soccer. So we've seen a lot of sprains and strains, and unfortunately we've also seen some broken bones as well. And I mentioned earlier how important it is to get folks seen without waiting. And Chris mentioned the low dose x-ray, but we've been able to get folks x-rayed, and unfortunately some of these bones are fractured, and we will set those folks up with an appointment with an orthopedic specialist within 2 to 3 days following the appointment.
Walk our audience through what they could expect if they were to come here.
Well, as I mentioned before, no appointment is necessary, so we pride ourselves on you being seen as soon as possible. So when you walk in the door here at our Abington Health Urgent Care Centers, someone at the front desk will almost always greet you with a good morning or good afternoon and introduce themselves. And as I mentioned, we really want to limit the wait time because we know folks have busy lives. So our idea is to get the patient in, get them seen, and when I say seen, I mean treated with the quality and care that they deserve and the respect that they need. And we really pride ourselves on safety and quality as well. So although we pride ourselves on seeing patients quickly, what's more important is they're seen with quality care and under Dr. Notte's leadership with the highest medical attention necessary.
Okay. And what about the staff? Who will the patients see?
It's a great question. So our folks here are wonderful. We have a great team at both locations. Our urgent care centers are staffed first by a physician, either an emergency room trained physician or a family care physician, and they are supported by either a medical assistant or a radiology technologist. And those three folks are always here from the moment we open to the moment we close.
Ryan, what types of patients do you see here?
Well, we actually can see a wide array of ages. Our physicians are trained to see folks 6 months and up. And one of the great things about being under the Abington Health umbrella is many of our folks that come in do not have a primary care doc. And that is vitally important to maintain wellness and their health throughout their life. And one of the things that we do, and we pride ourselves, is we ask every patient if they have a primary care physician. And if they don't, we highly recommend that they get one. And not only that, we utilize the great scheduling advocacy program that we have and set up an appointment with one of our physicians. We have over 40 physician network sites across the service area that Abington is affiliated with, and we do our best to set up an appointment as soon as possible with each and every patient.
No, I really appreciate the opportunity to talk about something that's very near and dear to my heart, and certainly Ryan's. I think we're very passionate. We care quite a lot about all of the things that we talked about here. But I think most importantly, I think quality and patients being principal and first is what we're going for. We want the patient experience to be second to none. We want people to feel comfortable referring friends and family here. We also want them to leave here feeling confident that they got the right care. And we're not going to try and treat them if we don't feel it's appropriate. If we feel that the patient belongs in the emergency department, we're going to make sure that they get there and get there safely. And one last thing I wanted to mention, we have incredible relationships with a referral base here with specialists in orthopedics, everything from orthopedics to ear, nose, and throat specialists, plastic surgeons, and we can get folks in using a really unique service at Abington called the scheduling advocate process, where we can actually hand off the case to a specialist, someone who is incredibly skilled and charged with getting patients in to see specialists right away. That specialist will take the case, will get that appointment, will be on the phone with that patient within 24 hours and say, look, here's where I got you an appointment. I've got a great appointment set up with a great doctor, somebody at a dermatologist office or plastic surgeon, someone you wouldn't have been able to get into for months. We got you in within a few days. And I think that that's the kind of thing that Abington is trying to do. We're trying to deliver on the promise of really bringing continuity of care right to the patients, and I think that we do that really well. So I'm really proud of that as the medical director. In the 2 locations that we have, I think we've been able to so far deliver on that promise, and I look forward to expanding that to other locations where we can continue to do that.
Well, thank you both for your time today.
My
Thank you,
pleasure.
Karen.
Thank
Thank you.
you.